Diverticulosis and its inflammatory consequence, diverticulitis, is a very common condition in the United States, just based on the diet we typically eat, which tends to be lower in fiber than in other countries in the world. If you're above the age of 50 and you take your age and add a % sign to it, that's the chances you have at least some diverticulum on your colon. Diverticulum are these small little outpouchings that we develop on our colon, and they happen naturally because there are natural weak spots within the wall of our colon. And as it's squeezing and pushing things through, you think of those old toys where you squeeze them and the eyeballs bulge out. Similar concept. As over time, you just get these weak spots. Now the good news is that even though diverticulum are very common, diverticulitis, that's when they get inflamed and infected and cause pain, that's actually quite rare. Only about 1 in 10 people who have any of these pockets will go on to have trouble with them. And for the most part, it is fairly treatable. The best thing is that if you start having pain, especially if it's kind of lower on your left side, which is the most common area, talk to your doctor. This is the one that's very common. Someone's first episode is their worst episode because they don't know what it is. They think, I strained a muscle, I ate that weird chicken again when I knew I shouldn't have, and I'll just let it go. And before you know it, it's 5, 6, 7 days, they're feeling worse and worse, and then they show up at an emergency room with severe problems. If you start having issues, talk to your doctor. If they need to check you out, they will. If they have suspicion, they'll treat you and you'll feel much better, much quicker. A lot of times we can deal with that issue without surgery. However, if it becomes a very severe bout of diverticulitis, or if it's starting to happen more frequently, you're having to take time off of work because of discomfort, you're afraid to go on vacation because you don't want to get sick while you're away, and it's kind of inhibiting your lifestyle, we have very good surgical options. And when we do surgery for diverticulitis, especially if we do it on my terms, that surgery is pretty much a breeze.